Hey everyone, welcome back to the channel. And in today's video, we're going to be exploring Obamacare, also known as the Affordable Care Act, which is a law that has had a huge impact on healthcare and insurance throughout all of the United States. So if you're interested in Obamacare and want to know more about the wide range of benefits that it offers, then this video is going to be for you. Also, if you prefer personalized assistance about Obamacare, everyone is eligible to get a free consultation. If you want to know more, check out the number on the screen or in the description down below. Now, the Affordable Care Act, also known as Obamacare or the ACA for short, is a law that was passed in 2010 to improve healthcare in the United States. Its main goal was to make healthcare coverage more available, improve the quality of healthcare, and lower costs. One of the primary aspects of the ACA is the provision of substantial financial relief through health subsidies for households with an annual income of less than $100,000. And a crucial factor to consider here is that these subsidies can cover up to $1,600 per month, which means that you're getting an allowance for expenses like prescription drugs, health insurance, doctor's visits, and preventative care. So let's break it down. Many Americans face challenges in affording their necessary medications. The ACA's health subsidies can significantly reduce these costs, ensuring that necessary medicines are accessible to everyone across the board. With the rising costs of health insurance, the ACA health subsidies provide relief by covering a portion of the premium. This helps make health insurance more affordable, increasing the number of insured Americans. Regular checkups and doctor's visits are vital to maintain health, but they can add up over time. ACA health subsidies help offset these costs, ensuring that everyone can receive regular medical attention. Preventative care is a crucial aspect of healthcare as well, which is often overlooked due to the cost. Preventative care includes screenings, checkups, and patient counseling to prevent illnesses, diseases, or other health problems. The ACA ensures these services are within reach for everyone through their health subsidies. Let's also address the significant benefits for the self-employed. The ACA allows the self-employed to save thousands on healthcare costs. Family health insurance can start at a mere $10 per month, practically unmatched rate that brings peace of mind without draining the wallet. With the cost of living on the rise, such savings can have a significant positive impact on the financial health of self-employed individuals and their families. Now let's focus on a different aspect of the ACA, rent and housing assistance. The ACA understands that healthcare isn't the only concern for low to medium income households. Many also struggle with housing costs, a fundamental necessity. The ACA provides assistance for rent and utility payments in 2023, providing certain criteria are met: U.S. citizenship, meeting the annual gross income requirement, and qualifying as a senior or a person with a disability. In today's digital age, having a smartphone isn't a luxury, it's a necessity. The ACA also provides eligible individuals with a free smartphone, which includes unlimited minutes, texts, and data, including 25 gigs of high-speed data. The smartphone is an Android device, and there's no annual bill, contract, or any activation fees. The ACA is a comprehensive solution that encompasses not only healthcare, but also aspects of day-to-day living, making it a truly revolutionary act. This makes Obamacare plans especially beneficial for low-income families, freelancers, and people with job-based insurance, and those with pre-existing health conditions. Can't stress that enough. With such extensive benefits, we really highly recommend that you take the time to understand the assistance that you're eligible for under the ACA. For more personalized advice, you can take advantage of a free consultation by calling the number in the description down below. Ever since this law was put into place, it has continued to show how helpful it can be for a ton of Americans, especially these past few years. With the current inflation increasing, the prices of cars, electricity, gas, housing, etc., even meat and eggs, lots of Americans are skipping out on health insurance with all those costs rising, which was unfortunately not excluded from the price hikes either. But what most people don't realize is that the ACA is made to help people get better healthcare without carrying the extra burden of added monthly costs. And this law also helps medium income households and is not exclusive to just low income ones. And on top of that, if you get an insurance plan through Obamacare, you may qualify for financial help like tax credits and cost sharing reductions, which can help lower your monthly insurance payments and out-of-pocket costs. And depending on your income, you might even be eligible for free or low-cost insurance plans where the government helps for most or all of your coverage. And so this would allow you to use your money on other essentials like gas and electricity instead of spending way too much on medicine and general checkups. And another important benefit of the ACA is that you cannot be denied coverage or charged higher premiums because of pre-existing conditions, which means that even if you have a health condition like diabetes or cancer, God forbid, you can still get an insurance plan that covers the health care that you need, unlike non-ACA plans that may refuse coverage altogether for certain medical conditions. Now, another nice benefit is that insurers in the ACA marketplace are required to provide clear information about their plans, such as deductibles, copays, and covered services, which means that you won't have to deal with complicated paperwork or any surprises when choosing a plan. And with Obamacare, you have the right to appeal insurance company decisions if needed. And also, if you have any children, you can keep them on your own plan until the age of 26. Plus, your insurers cannot set limits on the amount of coverage you can receive each year or even over your lifetime. They must also offer a minimum level of coverage to guarantee access to essential healthcare services. Also, ACA insurance plans must have a network of healthcare providers that meet certain quality and accessibility standards. And this gives you access to a range of providers to choose from that have already agreed to accept your insurance. Even if your preferred doctor or hospital is not in your plan's network, you may still be able to see them at a discounted cost by paying slightly more out of pocket. On top of that, all plans offered through the ACA are required to cover essential health benefits. These include preventative care, hospitalization, prescription drugs, mental health services, and much, much more. Also, Obamacare can be especially beneficial for women when it comes to healthcare products and pregnancy costs. It ensures that women have access to preventative services like contraception, mammograms, and screenings without additional charges. The ACA also guarantees that all of its plans cover pregnancy and helps reduce the financial burden for expectant mothers by providing comprehensive prenatal care and coverage for childbirth. And if you want to check out the full list of essential benefits or explore other perks you may qualify for, you can contact the number on the screen. Now, even if you're a healthy person, having health insurance is still necessary. For example, it allows you to access preventative care services like checkups and screenings, which help detect potential health issues earlier and keep you in good health. And another benefit is that if you ever find yourself, God forbid, in an emergency requiring medical care, having health insurance can help cover the costs and reduce the financial burden. And if you already have insurance outside of the ACA, it might be worth considering switching to the ACA for a few reasons. One of which is that you may be able to save more money by being on an ACA plan because the ACA marketplace provides an easy way to compare different plans and choose one that suits you based on your situation. And on top of that, being enrolled in an Obamacare plan guarantees you coverage for essential health benefits like preventative care, maternity, mental health, and substance abuse assistance. These benefits are all packaged together and included in all Obamacare plans, unlike non-ACA plans that get to pick and choose which ones that they want to cover. So to sum it up, if you choose a plan through the ACA, you're more likely to have broader coverage and access to essential health benefits, which means that Obamacare plans can potentially be a better option for many people, especially low-income families, freelancers, people without job-based insurance, and those with pre-existing health conditions. And if you're curious about the benefits you may be eligible for, I really do recommend that you take advantage of a free consultation by calling the number on the screen or in the description down below. So that's it for today's video. Feel free to comment below if you have any questions, and like and subscribe if you found this video to be helpful, or if you want to stay up to date with our future videos. Guys, thanks so much for watching, and I'll see you in the next video.